official statement that we are not promoting aggression. Okay. And you can read this later. It's nothing that you can't read when you download the PowerPoint. So go ahead, Liz. Our usual meeting etiquette, being muted, submit comments. We have somebody dedicated to looking at the chat and the questions, and we will take those at the end. It is being recorded, and closed captioning is available. Okay, so here's our agenda. So you can look at that, but I want to tell you, and I'm hoping that there's enough people here that can actually hear, because this is important from us to you. The purpose of this meeting. You know, everyone knows that the DDA has published the proposed amendment to the current waiver. It came out on the 9th. By regulation, they have to give 30-day public comment period. So the waiver proposed amendment is close to 600 pages. Well, clearly not everyone can read that. There's a whole lot of technical language in there. But we do encourage everyone to look at it and at least look at the summary. We're going to give you, as best we can, some highlights. We are not going word for word, line by line. We are going to give you some things that we think are important to you because you've told us they're important to you, and things that we have just picked out as important for comment. We have been, just like the other advocacy groups, scrambling the last week and a half, 2 weeks, to understand this and digest it and formulate some thoughts on it. So understand that we might make some mistakes. If you've discovered something we haven't, please just share it with us. We are not perfect, and we're burning the midnight oil just as you are, under the same emotional duress that many of you are under too. You know, we're feeling the rage as well. So please understand that we're doing our best to give you what we think is true right now. And we're open to any feedback you give us that we have missed something. So we're going to talk a little bit about advocacy, what we've done. We also are real clear that we have not kept you up to date on all the things that we have done. So we're going to give you just a little bit of context of kind of what about waivers and stuff. And then we're going to go into some of those areas of concern to you all. And with the point being to make it as clear as possible to you what the DDA is proposing. We are not going to be telling you what our comments are because we don't have them yet, right? We don't know what there's many things that need clarification. There are many things that need research. So we're not at the stage where we have formulated a response yet. But when we do, we will certainly share it. And you all are out there doing great research too, and you're formulating your comments. So we're all in this together. Okay, just for some context. And, I've said this to you guys a lot of times. I'm a psych nurse. I have been for years and years and years. So I think of people's stress levels and mental health levels. We need to put this in context. We are taking a hit right now, no doubt about it. And we have been taking hits, and we meaning self-direction. But it is really important for us to look at what we have and how far we have come. And we are in a battle right now, but this is not the full war. So we have been doing self-direction. I've been working in self-direction probably just about 20 years, so we're close to it. And at some point, and this is what's happening in other states as well. You introduce self-direction. People loved it. People got good at it. The state says, yeah, we're a self-direction first state, and invited more people to self-direct. And more the self-direction programs in different states grew, just like ours did. And all across the country, states are saying, oh, whoa, no, what did we do? And they're pulling back on self-direction. It is not just in Maryland. So, obviously it requires response. But just to know that self-direction is here to stay. The demand is high. You all have seen the results. So we just need to weather this particular storm as the other states are weathering it as well. In 2016, some of you, I see, when I saw all your faces, you were right there in this battle. Remember when they were taking family of staff away? And we had to fight to get it. We were involved in the waiver renewal process and getting family of staff. On the heels of that, That's what spurred us to do the Self-Direction Act. Many of you were involved in all of that. We put legislation for 3 years in a row. And by the third year, the legislators said, hey, there's something going on here. And they studied it more, and they involved a lot of people. It was a big, long work group. Many of you were involved. Then we got the law. So it's not going away. We're just in a period of greater fight, right? Just to put it in context. And we feel like advocacy is the long game. We get some wins, we get some losses. In this particular administration, they are not declaring self-direction as Maryland as a self-direction first state. Okay, so we just got to weather this storm.
So I just wanted to update you. As Patty said, we've been, frantically working, even though we haven't been very good about updating everyone. But we do have regular meetings with a variety of different people. So even though the regular meetings with DDA ended suddenly with the change of administration, we have been working hard. And just going to highlight a couple of the ones that you might not be aware of that are kind of current and ongoing. We've been working with DRM, and they've been working with the Assistant Attorney General to retain services in the auto extend budgets, including IFDGS and day-to-day administrative supports. They're also helping us look into some blanket denials that people are getting when it's just not clarifications, just not economically feasible, and that's the denial thing. We're collaborating with one of the better legal firms in town, Disability Legal Terms, to see what about broad service denials and about some of the pieces of law that perhaps these proposals might violate. We are continuing a contract with the Down Syndrome Association of Maryland to assist participants in developing and submitting complaints to the Office of Civil Rights. We're working with all of our advocacy groups in Maryland, the DD Coalition, Disability Rights, ARC, People on the Go, key legislators and trusted allies. Working together is really the key here. So, and individually, we've worked with DDA to have them fix some of the exception wages for the GeoDiff, to reduce the 3-month waiting period for filling current jobs to 2 weeks. We've done ARPA grants on sustainability and have a really interesting and robust report about that supports the day-to-day administrator that is so important to many of us. We've worked with others about the manual that was put in November and has been updated based on some advocacy that we've all done, really. So we are continuing and working hard in the background, and I guess we just wanted you to know that and to continue and to thank you, honestly, for your comments and your statements are the backbone of how we decide what is most important to the members and what's most important to spend our time and energy on. So a big thank you to all of you who came today and who are in regular contact with us. This is a village, takes a village, and we're extremely lucky to have you a part of our village. So thank you. The waiver amendment, as you know, part of the reason that the amendment was done in the timing is that the 2026 budget passed by the legislature required some waiver changes. It required changes regarding the geo-differential and changing and honestly reducing that. It reinstated a cap of $5,000 limit on the IFDGS, but it also pulled the day-to-day admin out of that $5,000 cap. We're seeking some clarification. There's some information that legislators restored a particular number of 7 million specifically for the day-to-day support, but we don't know what effect that number had on some of the things that DDA is proposing, honestly, in the 10 hours per month. So I think that's pretty much the reasons that this had to happen at this moment, and the speed. So some of these pieces in this proposed amendment are based on legislative requirements, and many parts are not. It's, oh, somebody asked, it's 7 million. Thank you for clarifying. So in terms of a big picture of the waiver, we are currently just starting, I think in July, the 3rd year of the waiver that was approved July 2023. DDA is obviously proposing a waiver amendment. They have to address the legislative bill, but they have also to incorporate some changes that CMS has made in the interim period. But as I just said, DDA has gone much further than that and has proposed significant changes that are not required. So one of them has to do with legally responsible people. They are legally responsible people are either parents of a minor child, natural step, adoptive or foster, legal guardians, or some court-appointed relative caretakers. When a legally responsible person is paid for providing direct waiver services, decisions regarding the hiring, firing, wages, schedules, vendors, and the like, including the legally responsible person, they are deciding that it has to be done through a supported decision-making document. And we'll talk more about that at a later point in the presentation. And then another piece that is new to this waiver is DDA has instituted that legally responsible people must request to work for a person, and then DDA must either approve or deny that request. So family of staff has been expanded. The definition of relatives specifically now includes step siblings, grandparents, step grandparents, aunts, uncles, nieces, nephews. All relatives may be paid no more than 40 hours a week for all waiver services rendered. And when a relative is involved in directing waiver services, all decisions about the hiring, firing, I think we talked about this, must be through a supported decision-making.
Please should clarify that it's not involved, it's paid.
Paid, I apologize, paid. And I think
so, we don't want to go into too much detail here. This could be an entire topic. In fact, we think we've already done a whole meeting on supported decision making. It's not a new thing. And I don't think it in and of itself is something to be scared of. We don't know how exactly it's going to be utilized. It's required when a relative or legally responsible person is working for the participant. And we do understand this raises a lot of questions and concerns. So, it's something we're just all going to have to kind of get more information on. We've put 2 links into these slides, and we'll be sharing these slides. Disability Rights and Maryland DD Council both have some very good information, and you can get educated more on what that means, what supported decision making means.
Yeah, I think we should have another meeting too, like more in context with this.
And when I also think it really depends on the process and what that's going to look like.
Right. We just don't know enough right now. Yeah. Okay.
Personal supports. So we're going through kind of sharing what we see from the amendments of kind of the major things that we're seeing. Not we like Patty said, we don't know enough to really know our full response on it, but just to update you on the biggest issues we're seeing. PS overnight staff now must be awake and alert. A schedule of tasks must be included in a behavior plan or nursing care plan. That is a new thing. When there is a specific documented behavioral or health safety need, higher intensity personal support and or services may be authorized for up to 6 months to allow for the development of an approval of a behavior support plan and nursing care plan. That is new. Before you couldn't get it if you didn't have those plans in place. PS Awake overnights, PS Supports Enhanced 1-to-1, CDS 1-to-1 or 2-to-1. What was the thought there? I'm sorry, guys.
Those are the higher intensity services.
Okay, those are right. Employment services, ongoing job supports. A few changes here. The job must have the qualities of competitive integrated employment. May be provided via remote technology now. So if you're on your job and you need some support, your support staff could connect with you via FaceTime, Skype, or another remote option. Participants who have been authorized for employment services, follow-along supports, and/or employment services, ongoing job supports for 2 consecutive plan years without securing employment, they'll lose that in their plan and will not be able to get it back again until they've secured employment. So you can have it for 2 years, but if you kind of go unsuccessful, you have to get a job and then do a plan revision or put it in at your annual. Participants who have newly added an employment goal, including participants new to service, employment services follow-along supports, employment services, ongoing job supports may be authorized even if the participant is not currently employed. That's a good thing. Some people are close to getting a job, and rather than having to wait for a plan revision to get ongoing job supports, you could have it kind of there and waiting for you. Environmental modifications allows smart home devices installed in a home, such as a voice-activated door opener, blind, shade openers, those kinds of things. Respite care services. Out-of-state camps may be approved by DDA based on state licensure requirements. In-state camps must be certified by Maryland Department of Health. The purpose of this service is to give the primary caregiver, so you might be a paid staff, you might be a parent that's a paid staff, but you also offer gratuitous care outside of your hours that you're clocked in. If you're the primary caregiver, then you cannot be paid to provide this service because you are the one really receiving the benefit. The purpose of this is to give you a break.
Okay, so I wanted to highlight some of the things about behavior support services. They have clarified the inclusion of dedicated supports, which is personal supports awake overnights, personal supports enhanced, 1-to-1, CDS 1-to-1 or 2-to-1, in a behavior support plan. So it requires a behavior support plan. Expanded the qualified professionals who can do the assessment and consultations to licensed graduate level professional counselors, licensed master's level social worker, and board certified behavior analysts, which were always included. And they've removed the requirement for high school diploma or GED in terms of people implementing that plan.
Sure. Nothing substantial in the nursing change. They simply changed some language. Instead of they had in there something about 24-hour or 7 days a week availability of the nurse on call kind of thing. They changed it to the actual language that's in the Nurse Practice Act that is the same. The nurse must be readily available during all hours that staff are working under his or her delegation. So nothing that should affect you all personally. Live-in caregiver support, defined as someone residing in the same household as the participant, not in the family home, and who provides supports and services. So if a person has an apartment or a home and they would like to employ a live-in caregiver. Reimbursement is limited to the months in which the service agreement is successfully carried out. Participant responsible for unmet rental obligations. A sibling may be paid to provide this waiver service unless they are legally responsible or the legal guardian.
All right, support broker services. Support brokers must agree to a code of conduct. Support broker services are required when a relative, legally responsible person, individual, representative payee, and legal guardian serve as paid staff to assure proper oversight and quality assurance, as well as reduce conflicts of interest. When the participants select a relative, legal guardian, or legally responsible person, to ensure quality of services, support brokers can provide collectively for all participants they support up to 40 hours per week of support broker services. Support broker administrative non-billable activities include, this is a sample of attending training course, non-billable activities include attending training, correspondence, or research. We definitely need clarification on that because that's a very open-ended. and creating and issuing invoices pertaining to the support broker invoices. This is how I'm interpreting that, and travel time to and back from meeting with participants. So definitely some clarification is needed here. There is definitely some concern about the limit on hours if the support broker has scheduled 40 hours a week, and then there's maybe an emergency, or maybe it's a payroll issue that week, and then lots of people have extras. What's going to happen? Will support brokers not be able to pay if they work extra those weeks? So definitely more clarification needed.
So individual and family directed goods and services. I think we all know now that there's a $5,000 cap. That was the cap that was there before the self-direction. It's been put back on, reinstated due to the legislative budget bill. So I understand that the IFDGS approved above this limit that's part of your current plan may continue until the end of the plan year. This IFDGS $5,000 annual cap does not include the day-to-day administrator. However, the number of hours has been capped at 10 hours per month by this proposal. So it's added that a person must first access integrated programs or activities that are available to the public, free or at a lower cost. And whatever the choice is, it must be the most cost-effective way of meeting the participants' needs. It may not be requested unless you have a approved person-centered plan. The IFDGS includes fitness items purchased at retail stores up to $1,000, so that's a new thing. Items related to the person's disability and recommended by a medical professional and not otherwise covered by health insurance are included. Dental services recommended by a dentist and not covered by health insurance, such as anesthesia or denture services. But IFDGS is not going to include common household expenses, items or services purchased prior to DDA approval, tickets, memberships, and related costs for what they're calling recreational activities and events, such as museums, zoos, bowling, and indoor skydiving. That's an interesting particular. And this one is, to me, something we really need to focus on. Programs and activities that are exclusive for individuals with disabilities will not be covered.
So we know this has been a big topic on the Facebook page, the day-to-day administrative supports. So as described by Self-Direction Act of 2022 and the current waiver. In the Self-Direction Act of 2022, it states a budget for self-directed services that provides the ability to use funds from the recipient's approved annual budget for the purpose of funding at least one position to assist the recipient in managing the recipient's home, staff, and other administrative duties, and pay administrative expenses needed to operate the recipient's plan of service, including internet service and office equipment. The current waiver says day-to-day administrative supports, which include assistance with all aspects of household and personal management, essential to maintain community living, including support with scheduling and maintaining appointments and money management. So the proposed amendment to day-to-day administrator, this service provides assistance with household management and scheduling medical appointments, limited to 10 hours per month. Legal responsible person or guardian may not be paid to provide this service. Providers of this service are limited to 40 hours per week total. Participants must be 18 years old or older and unable to perform the role independently. Support broker services required when any person provides day-to-day administrative supports. Individuals may not provide any other Medicaid waiver program service to the participants. So right now, if you are doing 10 hours a week as a day-to-day admin and working 20 hours a week as providing personal support, we don't believe that's going to be allowed in the future. This service does not include making payments or other financial managing finances, approving and signing timesheets or vendor provider invoices for waiver services, tasks which can be provided by personal support staff, which include budgeting, money management, maintaining a home, cleaning out a refrigerator, specifically mentioned, ensuring paper products, etc., meal preparation, personal care, house cleaning, chores, laundry, and overnight supports. And then tasks which can be provided by support brokers or personal support staff or other team members. I can't see the bottom of this, Liz, but I believe it says such as staff scheduling and dealing with any HR issues. So as you can see, there's quite a big switch from the original intent and what the law says in the Self-Directed Act of 2022 compared to these changes now.
Stephanie, would you go back that slide and reiterate what is in the current waiver and what the state law says? So people now that they see what the proposal is.
You go back, Liz, one slide.
There, you know, it is, this first definition here is state law, is current state law.
Yes. Right. So as you can see, and you know, when you look at the CMS, I know Liz has done some research on this. When she looks at the CMS, there is no role in there that pertains directly to, like, that is called day-to-day administrator. The closest thing would be a household manager. In the residential side, the closest thing to what a day-to-day administrator does, if you are in provider run services and you receive residential services, it would be a house manager. And so these are the things a house manager would do, right? So now now that you've seen that second list, if you haven't read it yet, really in the talks that Rhonda gave, the primary thing she mentioned that a day-to-day admin can do is schedule your lawn to be mowed and schedule your sidewalk to be shoveled and make doctor's appointments. But the day-to-day admin can't pay for those things. They can't help you pay for those things if you're the participant and needs help paying for those things. So over the past 8 months, since last October, I believe it was, SDAN has had a representative on the Waiver Advisory Councils. And then the Waiver Advisory Council started a subcommittee where we're meeting weekly and really diving into, you know, the waiver and possible amendments. We were then directed and guided to really look at ways that we could suggest cost containment, knowing that state was kind of headed into a crisis with funding. And the bulk of those weeks were spent focused on self-direction. And we really tried to, you know, veer them away from, you know, and like, let's look at all services as a whole. But faced with a determined effort to eliminate day-to-day administrative support hours and based on input from persons with lived experience and families, looking back at extensive discussions on the legislative work group that was the basis of the SD Act of 2022, SDAN made the following recommendations to DDA. Create a decision tree tool, which you've probably heard mentioned, to determine the number of administrative hours each individual participant requires and identify resources to most effectively meet the need. Maintain service availability for the day-to-day admin at no less than 15 to 20 hours per week. Preserve the ability of the participant living in their family home to hire a parent or legal guardian to provide this service for up to 1 year, enabling them, that parent, to define the job, or whoever was the primary caregiver, to define the job or job description and prepare to hand the role off to somebody else. Remember, the intent of day-to-day administrator is sustainability for self-direction. When those that are volunteering their time right now to make things run smoothly aren't there in the future, how is that individual going to stay within self-direction? That kind of was that original intent. Create accessible resources and supports for people with lived experience as they learn to independently manage their own daily lives and waiver services as they choose. Remove the day-to-day admin from underneath the IFDGS, at least the portion that has the $5,000, you know, that we didn't, as they were talking about kind of having a cap back on IFDGS, we wanted to make sure day-to-day admin was not part of that capped portion. And so DDA cites that $7 million in legislative allocation to fund day-to-day administrative services as the basis for this 10-hour per month new limit. So the decision tree that has been mentioned, right, that's been mentioned in every presentation that DDA has done. The decision tree was really intended for the development of it was to be with amongst an individual's team, their PCP team, their support. And it was kind of to help them decide who would do what roles, knowing that there's lots of things an individual might be able to do for themselves or want to do for themselves. Some individuals, somebody in the self-directed in the waiver advisory council said, I want to learn more, how to do more for myself. I want to be educated and I want to receive training on how I can do more for myself. So then what if any identified needs could be done by unpaid support? Are there family members or friends that are willing to help out and do something for that individual? Other administrative needs could be met by the participant and their existing employees, kind of coming alongside them and doing it with them. Were there things a support broker could pick up and do? And then a CCS. And then what unmet needs were there at the end after you did that decision tree? Again, this was intended to be done within the team structure. This wasn't intended for DDA to do the decision tree and make the decision for you. That these are now the only two things that you're, shoveling your sidewalk and mowing, getting your yard mowed, are not the only things that your day-to-day admin could possibly do. It really is to be person-centered and based on the individual's needs, and every team is very different. Every individual is very different. And that got lost and is not at all the intent of our recommendation to DDA.
Okay, so a few things that didn't fit in those other places. The DDA is intending to go from 3 separate waivers, family support, and community pathways, into one waiver that would still have all the same services, and with the exception of what we just talked about. And those of us that have been around a really long time, they go back and forth this way. There's times there's one waiver. There's times there was one waiver and then a self-direction waiver. And then the family support waiver came along. So, that in and of itself is not something to necessarily worry about. It's what they do within the waiver that we need to look at, like we've been doing. You all know about an appeal process, right? And when you appeal a decision, one of the state may offer you a CRC, a case resolution conference. Some of you have had those with DDA. It's kind of a mediation kind of step. Well, they have changed that to be applicable only to if an eligibility decision. Say you get, you don't meet the eligibility for DDA, or you've gotten kicked off the waiver somehow or something to that. So they will hold CRC meetings only in regard to eligibility. I think that's a pretty big deal, so will not be available as it is currently. Throughout the waiver, there was always a statement pretty much under all the different services that they set out the requirements for that service or the limits of that service, but it could be otherwise authorized by the Deputy Secretary of DDA. They have struck that from each, so there are no exceptions. Their intention is to make no exceptions to what the rules are. And we all know that people live lives and people are different and their lives go up and down, and exceptions are always necessary in order to get your needs met. So we're concerned about that. DDA may involuntarily terminate a participant's enrollment in self-directed service model for overutilization of authorized services. Not a single one of us knows what that means. Other advocates don't know what that means. We have no idea what the DDA is actually referring to there. There's a lot of speculation. We could all try to make a guess, but this clearly needs to be defined and clarified by the DDA as to what they intend. They always have the ability to remove someone from self-directed service model. It isn't optional. They do not have to offer a self-directed service model. And if they feel that someone is not best served in self-direction, they have the ability to say that is not available to them. But this overutilization of authorized services, who in the world knows what that is?
So if you watch the DDA waivers, you've certainly seen this. SDAN is, we also encourage you to submit public comment on any topics, I know how to spell, that are important to you. Your comments do not have to follow a certain format or template. You can just write your letter the way you feel comfortable about it. If you do, there are links in the following pages to all the waivers, so you can read them for yourself. The changes are in red. It's pretty easy to follow along with what they're changing. But don't make it, if that fit seems too overwhelming, just put it in your own words. And we're not super optimistic of changes, but the more you bring up something, the stronger the message gets out, and it could be helpful later on. So these changes that we presented are still proposals. They're not required right now. SDAN is preparing our public comment. We're going to share it with you on maybe before July 1st. So that, if you want to wait till then, you can read what we're saying and think about that and what's important to you. The public comment runs through July 8th. They can be emailed to the DDA or mailed to the DDA. And then once the public comment period is over, DDA has to consolidate all the comments, say what they've accepted or rejected, and then share them publicly. And then it will also submit the amendment to the Centers for Medicaid and Medicaid Services for approval. And if approved, the amendment is scheduled to go into effect on October 6th. There's also the option to, and they didn't tell you about this, there's also the option to comment directly to the Center for Medicare and Medicaid Services. And this is how you would do it. And it's especially if you think the state's process is flawed, or they ignored you, or didn't give enough stakeholder input, or that your rights have been violated. So this is the email. You use this subject line. If you write a letter or you email, that's the subject line to use. You want to state who you are. You want to repeat the name of the waiver in the message. Say your concerns, what you want done. What did you think was wrong? Why do you want them to delay or deny? And there's a little sample. But I think what's really important too is the timing. So you don't want to send it right away. You want to wait until after it's submitted. So, do your comments for DDA, and then once you know that it's been submitted, then send your comments to the CMS as well, and that will help inform them as they do their review. And thank you. And this is just some links. If you pull the PDF out of the chat and put it on your computer or on your phone, you can click on these links and it'll take you to different things. It's DDA's website, which is dedicated. It has every one of the appendices. And then we also linked the services manual, the new self-direction manual. I think that's what's supposed to say. The DDA services manual. What is that?
Policy, the word policy.
The policy. Policy stuff? I don't know. You'll figure it out. And it was a late night. I'm sorry. And the Self-Direction Act. So we do that because one thing, I'm concerned is that a lot of people will think, well, this isn't really a change. We've been doing this. But there are many things that were kind of introduced in November with the new self-direction manual that we think of now as policy that aren't in the waiver, that they're trying to put in the waiver. So if you have an issue with those things, don't think that they're not new because they really are, just because we've been doing them. They really are new. And then there's Medicaid stuff, all that kind of thing. So hopefully those things are helpful. And here we go.
Right, we ask that you put your questions in the chat, comments. We will try to get to. We have 127 people on the call, so we're all going to have to be really respectful of people's time, but we want you to get a chance. So we will go through the chat questions first, and if we have time, we will open it up for comments. And Beth, who's leading us through this response? Beth, Stephanie?
I don't know where Beth. Beth, are you there?
I'm here.
Oh, okay.
Give us
Do
some
you want to
questions.
talk about the ones that came up, that maybe prioritize the ones that came up the most frequently first, and then
Yeah.
go from there?
There's a lot of questions not unanticipated about the day-to-day admin. And the questions that I picked up, and there may be more, were why not the legal guardian? You know, the day-to-day admin should be able to also do personal supports or another service. And of course, a question about the proposed number of hours. This is really information that you need to give back in your comments. You know, whether you're using that service, not anticipating on using it in the future, what the impact on the health and safety, you know, would be on your family member.
Got my key.
You know, in the event that most of us are doing this gratis, right? And there is a big concern of what happens when I'm gone, who will take this over, and developing that position. My own personal position is, and as I think Alicia said, this should be a very person-centered process. Every individual's living circumstances are different. Every individual's availability to natural supports is different. Who does the person actually want to have them help with certain things? I think, you know, the limitation on a legal guardian or a primary caregiver only being able to be paid in that role for a limited period of time is because it is about sustainability. And so, you know, if what we're looking to do is develop sustainable programs, then having the person who's currently doing all of that be the one to continue to do it does not help with sustainability. Other questions? Stephanie or Liz, do you want to see if there's something that's...
Yeah, give us a specific question, we'll give a specific answer. Okay, somebody.
There was a question about any changes to transportation.
I didn't see that.
Yes, and there is a service that is, Stephanie, can you speak to the transportation, independent transportation, not the mileage, the transportation service, where they said their day trips?
Oh, no, Deja.
So I'm trying to pull it up so I can actually be looking at the document, but I don't have it in front of me. There was definitely a comment in the amendment about, so an individual that uses, so there's mileage, right, that you all get within personal supports, CDS, but there's a standalone transportation. So if an individual, for example, somebody that my husband supports, he's a support broker. He uses standalone transportation to travel to visit his mom, right? And It's about a 45-minute drive. And so he uses like an Uber or Lyft or something to take him there. It's built into it so that he can see her on a weekly basis. There's a comment in there about day trips, right? You can't use the transportation for a day trip. So we don't know exactly. We need clarification on that. Exactly define, what does that mean? One concern that has come up and has come up in the waiver advisory committee is this inconsistency across the board with DDA, depending on what region or what person's reviewing, whether it's the FMCS reviewing your invoice or whether it's DDA reviewing your plan. There's a lot of inconsistencies, and it really depends on who that reviewer is, and that kind of needs to get fixed. It needs to be equal, right? There's equity across the board, so that if you're asking for something and your neighbor's asking for something, right, the exact same thing, then you either both get denied or both get approved. That's not happening right now. So we definitely need clarification, I think, on that question with transportation of what are they going to define as a day trip. That's kind of open-ended, and we don't really know. So we need all of you to ask.
There are questions about the supported decision-making document who needs it and by when?
I think it's the legally responsible persons who will be paid would need to, their person would need to have a supported decision-making document. There's a lot of good stuff in those links. So read about supported decision-making. It has a lot of good pieces to it, but it's hard to determine exactly the effect it's going to have on any individual person. Somebody was asking also when the changes go into effect. So at the moment, DDA is expecting that the waiver be approved. I think it's on or around October 6th of this year. The supported decision-making and legally responsible people requesting DDA approval to be paid staff, that looks to be an April deadline for that. Somebody also asked if that was everybody or if you were already working as family of staff for a person, are you exempt? And as far as we know, there was nothing stated about anybody being exempt.
Rachel Sullivan had put in there that it would include relatives as well. So if a relative is working for an individual that they are related to, the person would have to have a supported decision-making agreement in place. If you notice, all these themes here are about the government, the DDA's perception of conflict of interest. They are not challenging your decision-making as a guardian or a legally responsible person. They're putting in place what they think they need for the conflict of interest if you are being paid by Medicaid dollars. So if you're not being paid, there are no restrictions there. So we can disagree with them, but that's their motivation.
There's a lot of people who are talking about the support broker hours being limited to 40. And I think, as a group, we concur with that. Basically, I think from the person-centered perspective, I mean, if you work 40 hours and somebody calls you, are you not going to answer, or are you not going to get paid? So these are things that require the village again, for all of us to make our comments known, and how this may affect a participant, not only the participants, of course, but our beloved support brokers who work hard on the behalf of the participants. So yeah, I mean, make your comments. I do firmly believe that people will be looking at the comments this time. And so all of us participating, it's always a good thing, but this time it's very important, I think, that we all state what's important to any individual participant and their support group.
I've seen some questions in here about what SDAN is recommending. I want to be really, 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 really clear about this. Through the legislative session, we were consistently asked to come to the table with what alternatives, because they were going to cut stuff. They were going to cut things like as much as they could to contain costs. So we had to go to them. First, we did surveys and we ask everybody what they think. And then we get into, when people are calling us all the time, every day, emails and calls, and we surveyed support brokers. What are you running into? So that we could have an informed decision and recommendation to them. And we recommended what they should not cut. We recommended that we didn't come up and say, sure, let's make some cuts, right? They were going to cut the heck out of self-direction. And we came back with recommendations because they were demanding them. It wouldn't do any good to just say, we want what we got, because they were going to cut it if we didn't have a say in how they were going to cut. So we put in here in the slide deck the recommendations that we as a committee formed based on all the input that we got from members and asking people directly, and the people on the waiver council with lived experience. So we had to give them something. Of course, we don't want people to have their day-to-day cut. We came up with it. We came up with that. and got it in the SDS Act, or the Self-Direction Act. Of course, we don't want that cut. So you have to give us some amount of trust that we are fighting for the things you tell us you want us to fight for. But when the state comes back and says they're going to get rid of it, we have to be able to hold on to some of it. So please trust us. We hear you. We know that some of you have 30 and 40 hours of day-to-day support broker. They know it too, and they're going to take it away. So we suggested that, well, how about if we hold on to 15 to 20 hours? Well, they didn't do that either. So, we did not come up with a set of cuts that we thought should happen. We came up with what we begged to hold on to, just like we did 10 years ago and 5 years ago. And so,
right. And we also, Patty, I think we also shared very creative ideas of ways that, as a community, as a self-directed community, we thought that money could be better utilized. And so one idea was shared overnight staffing. If you have 2 or 3 people living together, right, they don't each need, possibly, maybe they do, but many cases, they don't each need a designated staff person overnight. So let's develop a way. Right now, there is no way within self-direction to share staffing. So let's figure out that problem. We went to them with that. They completely ignored that. But I can tell you, if there's 2 or 3 people that want to live in a house, your regional office, when reviewing that plan, is not going to want to approve a staffing person for each of those individuals. So I think we went to them with some very creative ways that we thought would not impact individuals, that would be optional, but could bring a lot of cost savings.
So we're really focused right now on developing comments to respond. And we've been told to make your comments specific, be civil in our comments, make them reasonable. Like Liz said, they don't have to follow any format. You can just speak from your heart. But the comment on each one of these items is important to you. And we are really hoping that the new secretary will read these comments. She seems to be a very reasonable human being. She has expressed to us the desire for the department to have a reset with advocates and build trust with participants. And so we're hoping that she will, in fact, read the comments that you submit, and we will read them also. And in addition to that, we will continue all other advocacy efforts, things through the legal system. No attorney has indicated over the last year that they saw anything that could be a class action suit. So we are looking at all those things, and we're looking at what's legal, what's not. But it all takes time to do that, and from this handful of volunteers. So, like I said in the very beginning, it is incredible the amount of research that you all do, and the things that you find out, and it just blows me away. So keep giving us information. It informs us. If you and contact us anytime. But I have for 20 years been doing self-direction. My son did self-direction. All of our kids do self-direction. We want it to continue, and we want it to be the way that we need it to be. So we've got some setbacks right now, but we will continue to advocate for the years to come. So are there other questions that did not get answered? If you have a question, you want to put it in the chat if we did not answer something. Because
there's one issue that comes up a lot. Well, the support brokers kind of brewing in there, and the day-to-day seems very important. But there's some concern about people who use things like Spirit Club and other vendors. And we share that concern. I don't know how that works, or whether those people will, become some kind of provider and then not an IFDGS cost. But these are great things for you to comment about the person-centered nature of these changes. So
Lisa, there's also a lot of questions regarding, not questions, but comments about CCSs, and kind of the joke that it is that the CCS is really going to do things that the day-to-day admin would possibly be doing. I think we all know that there are a few of you in this group that probably have absolutely amazing CCSs, and they are out there But along with that, there are ones that last a month. There are people that go for months without a CCS. So I don't know if thinking maybe that is something we want to look into. Maybe we do a survey pertaining to this day-to-day admin and the decision tree, and specifically like, what are the chances, do you think, of how quickly can you get in touch with your CCS? What are the chances your CCS is going to apply for SNAP for you? Or
Right.
But so ideas, if you have those, and individuals like kind of commenting in the chat about that, share those ideas on the page. Maybe we get a conversation going about that. I don't want to bash CCSs, but at the same time, our system is broken. We need to address that.
Right. Well, the decision tree was intended to be team specific. So you may or may not have a team that a CCS or a support broker or anybody else can rise to the top and do some of those. So it's not even across the teams. Just to piggyback on what Stephanie was saying, and well, all of us this whole time, we do want to hear from you. Now, we will keep the chat and review that, but we want to hear what you're submitting. info@marylandsds.org. We, on the other hand, will submit to you our comments, hopefully with enough time for you to review our comments and pick through what's important to you and the participant. And again, I want to reiterate the importance for us all to talk about the things that are important. Make this person-centered. This support self-direction, its hallmark is person-centeredness and employer and budget authority. Make your comments about the person-centeredness and the effects this proposal might have.
Somebody asked if you should contact your legislator. Well, always, right? Developing a relationship with your legislator, we've always supported that. In some conversations we're having now, the legislature are saying they did what they could. They restored half of the funding that was cut. They don't have a direct supervision of DDA or of MDH. They're separate branches of government. So they don't, the DDA does not answer to the legislators, except in the budget process, right? So it's always good to have a relationship with the legislator. If they can influence this is very questionable at this time. They certainly can make a call, but DDA that has the right to do a waiver amendment and offer the services that they want to offer, that CMS will sign off on in their plan. So do what you can. If you find an empathetic legislator, let us know. And if you find somebody that's really willing to get in the fray, let us know who that is. We support the heck out of them. But they aren't the automatic answer, not on a waiver amendment.
Right. The different branches of government has been pointed out to us recently. So, Patty, you might want to talk about this. Somebody's concerned about the change in wording to making all the employees a provider.
Sure. So that was asked several times. There's a statement in the proposed waiver that all employees or vendors, and basically anybody that is getting paid by Medicaid dollars, is considered a Medicaid provider and is subject to all the rules and regulations of Medicaid. That's a pretty clear government statement, right? If you're taking the money, you got to abide by the rules. So it's considered a Medicaid provider. There is a different thing as well that is called a Medicaid provider. That's when like a community agency or a sole practitioner like myself as a nurse will have to become a Medicaid provider, and we have to do an application to Medicaid and be approved as a Medicaid provider. It is not intended that vendors or employees of people go through that process. I think there's two different thoughts there. Now, we will seek for more clarification, but the fact that they say that you all that are taking a Medicaid dollar, like you're employed as a personal support or you're employed as a support broker, let's say a CDS or a personal support, are in fact a Medicaid provider. So you've got to abide by the rules, because there were people saying, I'm the guardian. I don't have to do this. I don't have to do all these rules. But if you are the guardian and you're being paid, you have to do the rules. So we think that's where that statement is coming from. Because if you're being paid, you have to do the rules. But that does not mean that you're going to make application to Medicaid to become a provider. You see, there's a nuance difference there. If anything changes with that, we will surely let you know if we find out differently.
Patty might be the best one to address this one as well. There's a couple times it's asked about what does the training, now that, let me find the exact question.
Oh, the mandatory,
DDA
the
mandatory training.
mandatory,
will everyone in SDS be
meaningful
required?
day. Yeah,
Okay,
no,
so
yeah, we looked at that. Patty can
and this
explain.
is always the way the waivers are written, right? So if you're going to go into Appendix C of any of our waivers, any of the 3 waivers, that's where all the services is. And there is a cadence to these, right? So they're written in a pattern. So when they have the service, they'll tell you what the definition of the service is. Who can have the service? What are the requirements of the person who's going to provide the service? So in that, the requirements of who's going to provide the service, it will have like 1 through 16 or something. Be 18 years old, have CPR, blah, 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 blah. And there's a list of DDA mandated trainings. But if you get to the bottom of the list, it says, if you are working in self-directed services, you only have to do number 1 through 6, or do number 1 through 9. So in the service, you have to read all the way down, and it will tell you what of this long list of requirements you have to satisfy in self-direction. So it's the things we already know. You CPR and first aid, med tech if you're going to give meds or treatments. It is not the list of mandated trainings that you do if you go to work for a community provider. That's usually listed in kind of 1 through 5 or 6. So no. So the short answer there is no. They did not increase the number of trainings that somebody needs to have in self-directed services.
Right. I think they just recycled the slide. It didn't adjust it.
Yeah, there is a list of those full trainings, but it always go down to the bottom where it says if you're in self-direction, you only have to do 1 through 6 or 1 through 9 or 1 through 10, whatever that particular service list is.
All right. Another question about supported decision making, asking, is it just guardians or is it the new list of relatives? Anybody want to address that?
Well, Rachel Sullivan just put in the chat that it was relatives as well as legally responsible people.
Right. Which seems kind of overbroad to me because you don't. But
remember, they're trying to address
conflict of interest. Right.
That's what they're trying to address. Their perceived conflict of interest.
Right.
You are a relative or legally responsible person, and you're being paid. Can't set the wages of
niece
everybody
and
else.
nephew aren't directing services, and they're not making any decisions. Like, to me, a supported decision making is for the decision makers.
We could go down that rabbit trail as we can. Everybody will have a
Right.
different opinion, right? This is just what the DDA is saying. Put your everybody make your comments if that's how you feel about that. I'm looking at the comments. Anything else? Somebody put it in the comments if something you want to answer that we haven't.
The only training most people need is the first aid and CPR with an in-person component. You don't need MAT training. You don't need, communicable diseases. You don't need all that. That's only for the other model.
Yeah, is it better to submit one big comment about everything you care about or multiple comments about small things? Well, they're big things, but single topic comment.
No, that's a good
Can I ask a question?
Well, wait a minute.
Can I ask a question?
Hold on a second. I want to answer this, Nina. You're asking whether an individual such as yourself should do one for every topic you're concerned about, or do one that was all. I think that's preference. I think it's that individuals should comment is the lead there, rather than organizations just commenting. So everyone should put in their comment. I mean, out of expediency, it's probably just to do one with listing all your concerns, but I think that's up to you. We've never gotten direct feedback about that.
Thanks.
Amanda, did you want to say something?
Yes, I have a question, and it's specific to me, but I think other families have had to deal with this. 2 years ago, we were told we needed a delegating nurse for them to sign her program. This year, they said they wouldn't sign the program, the PCP with a delegating nurse, and we had to take it out. So is that now a mistake that the reviewers did that, and will DDA contact us to get it corrected? Or do we have to get back to DDA to say, okay, do we really need a delegating nurse?
Well, I mean, that is a team decision, right? So that you all need to look at what does the participant need? If they need nursing case management and delegation, then it is in the PCP and it is in the budget. If they do not need it, and that's what the DDA is saying, is that no, you don't need it, then that's a discrepancy like any other discrepancy. It seems like that if it's clear that that is what your participant needs, then the CCS needs to be in touch with the DDA, right? It's just like any other service.
Yeah, because she's got many medical issues. I mean, I know.
Well, so let me clarify the difference between the two nursing services. It does not matter how much medical you've got, how disabled you are, nothing. It matters, is paid staff going to be administering medications or doing any treatments of any kind that have to be delegated by state law, right? Okay. So if nobody is giving meds that's being paid, nobody that's being paid is doing any treatments of any kind, then that would be nursing consultation. Right? It does not have to do with HRST level. It doesn't have to do with the number of diagnoses. Is the staff responsible for doing nursing care, such as meds or any treatments? And that would require delegation. So there's the demarcation there. If all meds and treatments are being done by unpaid people, you're good to go.
Okay, which they told us to put in the plan, that's what was happening, even though originally we had staff that were doing those things.
Well, it sounds like it's a team. The team needs to get clear and see if DDA made a mistake.
Okay, thank you. So where is this supported decision-making document that we're all going to have to do?
Liz, did you?
I don't. So, a supported living document, it already is. You can get a template from Disability Rights Maryland, but a lot of this stuff, like, we don't have the answers because DDA is going to have to develop the forms and the guidance and the training for all of this. So, like, we can't really tell you what this is going to look like. Hopefully, like in my head, I think it's, the team, the supported decision-making team will be, the same people, right? The support broker, the CCS, a family member, the participant, first of all. But we don't know the answer to those kind of questions, because that's the administration part of this. So, they put the rules in and then they figure out how they're going to implement them and what that looks like.
Before the horse again.
Mm-hmm. Well, somebody did put in the Facebook group, posted the supported decision-making agreement, and it is also can be found in those two links that we put in this presentation. So you can do some research on supported decision-making yourself, and you can lay your hands on that particular agreement. How DDA does it is yet to be determined.
Okay, thanks.
Anybody else? Adam, where are you? I'm surprised you haven't said anything.
Patty, there's some question about cost neutrality. Do you want to do a little synopsis of cost neutrality?
You know why I'm answering all these? Because I think I'm probably the oldest one of doing DDA.
You are Miss
Somebody else help me out, right? Yeah, so, okay, so according to Medicaid, you know, the Centers for Medicaid and Medicare, a waiver in and of itself, all the costs associated with that waiver, right, cannot be more expensive than serving that same waiver and all the people in it in an institutional level of care, right? And in Maryland, we have Holly Center and Potomac Center are our two institutions. So per waiver, they look at what they call the aggregate cost of all the people being served in that waiver and look at the institutional level of cost of institutional level care. And the DDA would say right now, and they are saying that as costs have increased and money has increased, that we are dangerously close to violating the cost neutrality, in which case the federal government would stop matching the money.
Patty.
Hold on. I'm sorry, hold on.
That's
So
Geneva.
they would stop, hold on a second.
Oh, sorry, everybody.
Hold on a second. Yeah.
Okay.
So the DDA is very concerned about cost neutrality, and they have conveyed that to everyone and to the legislators. So we don't feel that that's necessarily true, but we don't know because we do not have the amount of money, we don't have the number of what it costs to be served at Holly Center or Potomac Center. So there isn't anything that you all can do about that or that we can do about it. Just know that it is of a high level of concern. It is not about your participant in comparison to if they were in a group home. That is not cost neutrality. Cost neutrality is the aggregate of the amount of people being served in any one waiver and what would that cost be if that was all being done in an institutional level of care. And so it's something that all the advocate groups are looking at and researching, and but just to understand, it's not just your particular situation as it compares to residential or to provider.
Right.
It's Geneva.
Okay, thanks. Sorry to have interrupted you. I thought you might have been done. I apologize. Can everyone hear me?
Yes, please. Yeah. And
So
we're
so
waiting for.
one of the, as many of you know, and some of you also have loved ones who are duly enrolled in REM and receive private duty nursing through REM and are also enrolled in the DDA waiver. And of course, they're doing nothing to facilitate the coordination of these services here. But one of the things that I think is really important to advocate for is that in the facilities, there's a cost of maintaining the facility, all the things that are associated with the facility. But then at the level of individual care, the facility is allowed to enact a Medicaid HHA delegation program, which is less expensive than providing what's required in the community, which is 24/7 licensed nursing care. And so I am really at the end of my tether with this because I know that the HHA model can be applied to home care in Maryland, but Maryland is simply not doing it. So for people who are medically complex, comparing the fact that the state of this, I don't know if it's deliberate, but it's what's happening. They're jacking up the cost of caring for someone at home, but yet in a facility setting, that person would actually receive a lower standard of care. And so I feel like if they're not going to allow HHA, the Home Health Agency, which is a specific Medicaid designation, allows for an ongoing assessment of how much licensed nursing care someone requires and what of their care can be delegated, what tasks and during what hours each day. And so anyway, I'm just really upset at the cost neutrality thing being invoked when the state will not let people being cared for at home, reduce that aspect of their budget.
Right.
So
Excellent
anyway,
point,
I'll just
Geneva.
stop
It's an excellent point, and thank you for always being the one to rise, bring it up. But it's just another example of many ways that things could be done that the state of Maryland chooses not to do. And we're always looking at that. What could be better ways? But at this point in time, the state has stopped asking for our input on this, like better ways to do things. And that we don't have an avenue to do that right now. We used to, say, hey, we're all in this together. Have you considered? That's how we got the live-in, what is it, the EVV exemption, right? Remember, you guys are doing live-in care, person that lives in doesn't have to do the EVV thing, right? So it's because it was available, but the state of Maryland didn't do it. They said, oh no, we don't do that. But we knew it could be done. So we were able to advocate because we knew it was allowed, and we wanted Maryland to say, yes, we're going to do it here. And we advocated and we got it done. We don't have that avenue right now in this administration to suggest better and wiser and more efficient ways to do things and call on the state of Maryland to do it. We don't have the leverage and the cooperation that we did before, but maybe we will, like I'm hoping, I don't know how many more years I'll do this, but I'm hoping that, that we'll get back to being able to advocate for things like you just said, Geneva, a different way of doing it that would not be as expensive, and it would work especially for people with medical complexities.
So Patty, one more quick thing just to let you all know. So Rob and I have developed a collegial relationship with Ryan Moran, who is the Deputy Director for Medicaid. I am careful not to ask him for anything inappropriate or any inappropriate intervention. But I did decide to write to him yesterday to ask for some clarification on why on this HHA versus RSA model and some other issues. And he is on vacation until July 7th, but his bounce back email suggested I forward to Chief of Staff, if anything was urgent, forward to her. So I did that. And she responded to me this morning saying that, and I just asked for information and advice, because he's one of the people who looks at Medicaid globally. So in the state. So she said that they will look into it and get back to me. And if I have any information, I will forward that to the SDAN board.
Great.
Work out?
We should remember that Deputy Secretary Marlena Hutchinson used to work for Dr. Moran.
Okay.
She was second in command in Medicaid here.
All right. Well.
She came over to lead DDA.
Okay. Thanks.
So okay. Anything else that you can see how complicated everything is, and they've just made it more complicated over the last couple of years, right? But so if there's no other questions, I am always trying to leave you with some hope. And there have been times where we have had worse situations than this. I don't know that we've been in a worse economic situation than them. This is the first time I can remember, and if any of you can remember more, this is the first time I've seen them gut the DDA budget, right? Or the governor to suggest not funding the full DDA budget. So we have that as the backdrop, the economics that's going on in the state of Maryland. We will weather this storm, and we will continue to fight for you. And with that, I guess we will sign off unless there's anything else, Bernie. Anybody else want to have a question before you sign off or a comment?
Patty, this is Matt Rice. I just wanted to say, as far as trainings, it does appear, although we're trying to get clarification on, but it does appear that for supported employment, if you have somebody that's using ongoing job coaching, that the ongoing job coaching staff would be required to do like the acre training.
So yeah, it'll be service specific. Thanks, Matt.
Yeah.
Right.
Okay, well, you can look forward to, all there's links in there that, again, somebody was saying the link didn't work. I think you have to come out of the PDF and, right? Liz, you want to tell them how to do that? Because they were saying the links didn't work, but they do if you download this, right?
Yeah, they should work. But if you need, email us if you need
And we
anything, but
will,
you have to save it to your desktop or whatever.
we will provide you with the comments when we pull an all-nighter and get them written.
That'll be
Another all-nighter, like last night was, right? Another all-nighter.
fun. 3 in a row.
Thank
What are
you,
we talking about? Thank you. Have a great weekend.
Bye-bye.
Take care. We'll get through this. Bye.